at all, okay? So here are some of them. The best thing to hold on to in life is each other. That was Audrey Hepburn. The best and most beautiful things in the world cannot be seen or even touched. They must be felt with the heart. That was Helen Keller. Let us always meet each other with smile, for the smile is the beginning of love. That's Mother Teresa. They invented hugs to let people know you love them without saying anything. That was by Bill Keane, who's a cartoonist. All you need is love, but a little chocolate now and then doesn't hurt. That's Charles Schultz. Hang in there. Love doesn't make the world go round. Love is what makes the ride worthwhile. You know you're in love when you can't fall asleep because reality is finally better than your dreams. And the last one is, you can't blame gravity for falling in love, Albert Einstein.
Better give you the credit here. I'm gonna give.
The flag is up.
Oh, I know. Hang on.
Right. Greetings, Rotarians. Please join me into our wonderful flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. Thank you. That was a quick change.
Yeah. And let's see, I think Joe Stanford is going to honor us with America the Beautiful.
All sing together. Oh, beautiful for spacious sky, for amber waves of rain, for purple mountain majesty, above the fruited plain. America, America, God spread His grace on thee, and crown thy good with brotherhood from sea to shining sea.
All right, and thank you. Have a seat. We will go ahead with introduction of guests. Those having a guest, would you please invite them to stand with you? Yeah, Ozzy, we've got Ron back in the back.
President Vaughn, fellow Rotarians, my pleasure to once again introduce Elizabeth Wood, CPA, and happy to have you here.
President Vaughn, I'm pleased to announce that I'm introducing for the last time Bob Gilson. He's never coming back. No, actually, he has a membership application. All right.
Good morning, President Vaughn and fellow Rotarians. Oh, thank you, Ossie. Oh, here, actually, let's give this to Ron first. Oh, you did. Okay, I'm not paying attention. Welcome to our Zoom Rotarians joining us today. Marilyn Lynch, Chip Lanzi, Irv Erdos, Sandy McDougall, Ron Parker, Dan Sundquist, Rick Greenstein, Bernadette Blaney, Jill Campbell, Larry Trotner, all the way from Colorado, Jan Jones, and someone named iPhone EEE that will not tell me who they are.
All right, I think we're ready to sing, and Kristen is going to lead us and welcome any guest Rotarians. No?
No guest Rotarians today, but I'll still sing for you.
All right, and Myrna had to leave for an appointment, and so we recruited our superb pianist, Justin Gray, with his innumerable
Howdy, we're glad to have you here. Howdy, we sing it loud and clear. Relax, enjoy the program. Jump back and see us again.
All right, I think I recognize that style. Next time we want you to do it by Bach. Okay. I saw this come through. Gary Cook passed away. Does anybody know Gary? He was before my time. Okay, well, those who can give him a good heartfelt memory or two, this would be a good time. And you're going to have to follow up on the details. I didn't get anything else. Anyway, I should say that Larry Troutner sent me a very promising letter. We've been monitoring the progress of his daughter with her edema and surgery, and he said that she is now out of the hospital and they think they've got everything under control. They haven't figured out what caused it, and they're going to need to do some things there. But he will be joining us, he hopes, in a week. So he's been gone for some time. It'll be nice to have him back. And it's good news in that case. So a couple of things, interesting announcements. The Escondido Shine Street Stewards had a project this morning, and they keep charging ahead and doing some good things in the community. We appreciate all of those who participate in that. And Alex is going to give us a quick announcement on the upcoming concert for February 18th. After which Colleen McKinnon will come up and make an announcement.
Good morning, fellow Rotarians, President Vaughn, and our guests. The Pacific Lyric Association created a new youth symphony orchestra that will be performing in Escondido every February once a year. This orchestra going to be serving few purposes. First of all, it's our humble way to support young musicians who are getting their college degrees. We got 40 college students performing on February 18 who already got their bachelor's degree, working on their master's degree, or just graduated. And we given them little stipends for their participation. Because the life is tough for professional musicians, for kids who just graduated, it's even tougher out there to find jobs and gigs and stuff like that. The second purpose, of course, we're gonna introduce all these young players to our beautiful Performing Arts Center. We're performing at the Center Theater, one of, I say, the best facilities in San Diego for the acoustic performances. So, and all of them quite excited about it. We also expanding, by doing this orchestra once a year, we're expanding our pool of younger musicians for our opera orchestra in October. And of course, we're bringing classical music to the Escondido audiences, which you have the flyer on your table. If you scan the back side, it's gonna take you to our website. You can read about this orchestra, what we're gonna perform, and you can become our sponsor. Our sponsorship level starts from $50. It's not that expensive, but then you get free ticket and you get invitation, you get all information. And the code in the front, if you cannot make it to the concert, you're too busy and it doesn't fit in your schedule, you still can support us with a little donation. At this point, all cost is covered We raised substantial amount of money, and Jack Raymond matched our fundraising 1-to-1, which we are super grateful for that. And all money that we're going to raise from now on going to go in the pocket of these kids. We want to give them stipends and compensate for their gas and meals. You know, they $10 makes a difference in their budget. It's a jumbo burrito they can eat all day, you know? So there is no amount small enough. If you can donate $25, $50, please do that at the front of a flyer. Thank you.
I think everyone knows that Colleen is the chairperson for the CORE program. I think you're going to really enjoy what she's got to say.
Hi, everybody. Okay, can you hear me? Yeah, I can work a microphone. Okay, so I know you've all have been waiting with bated breath for a Core de Cuisine update, and today is the day you finally get one. Yay! So we obviously hit a little period of uncertainty with Omicron and the staffing crisis, and we've been looking for a solution to balance out COVID and economic and us partying and make it all work together. So we finally found a date that works to balance all the different factors. We are going to have Core de Cuisine. We're pushing it back 2 months to May 22nd. We should have the website up and running soon. I'm pointing at you. And if you want to sponsor Core, or if you want to volunteer on any of the committees, or if you just want to call me because you like to talk to me, my phone number is in the book and I will pick up when you call. Thanks, everybody. Okay. So we were getting a little bit of we can't do March from the restaurants. So Andrew and I went out on Saturday morning and we hit Grand Avenue and smiled at every shop and said, hello, do you guys want to do Core? And nobody told us no. We had 3 new restaurants sign up. We had the Tea Room is going to come. We've got Sunnyside that's going to come, and I'm blanking. Who was the third one? Sorry, it's a lot of information to hold in my head. But it was 3 of our regulars. Delight of France, of course, yes. How could I forget the croissants? So we had 3 new restaurants sign up, and then we had 5 of our regulars who were like, we want to hear, we want to come, but today is not a good day to say yes. Can you come back? So we're going to come back and talk to them. Doug has been working very diligently with Bernardo Winery, and they are going to start taking care of the vintners portion very shortly. Any other things you guys want updates on? Any other curiosity? Okay, so yeah, we're having a classic Core de Cuisine with restaurants and wineries and socialization with each other. So again, call me if you need anything.
And we're excited to have Keith and Charito frontline here as part of our celebratees. I was denied the opportunity to really enjoy their festivity with cancellation 2 days before our event. But we're back in mode and excited to watch it all happen again. Okay, these are the calendar events coming up. You've also seen that on the center view. So please stay in touch with us through Charito's weekly publication there. Andrew has been busy as always and impressive.
All right, 77 years ago. Oh, wrong speech. Sorry, that was a draft. Fellow Rotarians, up to now, I have been the liaison between the secret naming committee and the presidents. You will notice today there's going to be a transition of power. We're going to have an exceptional and much more attractive volunteer for this position, Miss Amber Smith. Would you join me up here, Amber? There's just one small issue that we have to address before I transfer this to Amber. She doesn't have her own nickname. So we're going to remedy it right now. Amber is a totally engaged wife, mom, financial advisor, and Rotary volunteer. She was volunteering for projects before she was even an inducted member. She was spotted several times helping her dad, someone or other in this club. Oh yeah, Bill, Dollar Bill, out at the money table in the back. As a new member, Amber is a frontline volunteer in several areas, including graciously releasing me from this liaison role. Half of Amber's DNA comes from Dollar Bill, which could give Amber the nickname of 50 cents. However, around here, she's priceless. So Amber, we knight you in W forever, priceless. And there's some more pictures and bags in there.
That's fantastic. Thank you.
You gonna do the next one?
I'm doing the next person as well. And it is my pleasure to also knight a relatively new member who I've gotten to know, Miss Donna Johnson. Do you mind coming up? We'll make it quick. Donna was one of the first folks I actually met that was new to me in Rotary. We have the honor of knighting a newer member who zoomed into membership last May while we were in the dark. Donna Johnson, retired energy engineer from SDG&E, is a lady of many talents. I've tried some of her recipes, and she also is sharing with us her quilts. They have earned first place at the county fair. You'll be able to bid on one at our next Coeur de Cuisine silent auction, so start saving your money for that May event. And she also enjoys playing the piano, even for us at times. Check out her license plate in the parking lot. And today we formally dub Donna and knight her as our piano girl. Donna, please stand and be recognized, our official piano girl. We have a sticker we'll put on your card. And
just take this?
Yeah.
All of it. Yeah. Oh, thank you. Thank you, everybody. I'll do my best, as long as I'm above ground.
All right, well, we are ready for the inimitable Jay Grossman again. What would we do without you, Jay? I think it's so great. Anyway, he's going to lead us in the song.
Okay, that's good. So the whole song's up. I don't have to press anything. It's to Home on the Range, okay? As you all know well, his name's hard to spell, but he's here to share what he knows. He'll review the year, try to allay our fear about problems that they may pose. Paul Hedgie's the guy who'll try to tell us why. What's happened this year is nothing to fear, and he's promised that he wouldn't lie.
All right, and Dr. Moyer is going to make the introduction, and then you're in charge of your own slides, Chief.
President Vaughn and fellow Rotarians, it's once again a pleasure to welcome Paul back. It's the third or the fourth year to give us an up-to-date on what we can expect and healthcare developments in the coming year on the state and national level. Paul was born in Brooklyn. His family wisely migrated to California. He grew up in the Sacramento area, undergraduate at Cal State San Marcos, Cal State Sacramento, an MBA with honors from USC. Worked in healthcare planning in Sacramento, and we're fortunate to lure him down to San Diego several years ago to become the CEO of the County Medical Society, which is just under 6,000 physician and medical student members. And under Paul's leadership, they've really expanded access to healthcare for all residents of San Diego County. Paul's very active in leadership roles in a variety of healthcare organizations, boards, planning, and we're so happy to have him back again this year.
All righty, everybody. Good afternoon. Thank you for having me back. This is, I think, my first in-person presentation, so bear with me. Luckily, I've had to do a few on Zoom here and there, but there was a little getting back used to it and a little warming up I found for a while. So it's a pleasure to be here and do this. For those of you who've seen my previous presentations, well, I'm thankful that I don't have my bookshelf behind me to call out my medical books by Stephen King as you did last year. But this is a completely different deck. The last few years, I've done more macro, what's going on with healthcare, where the big payers are, and where the kind of the push points, what the state and feds are looking at. And I have some talks about the state and feds, but there's been a lot of change there. And obviously, we're all impacted by a lot of COVID. And so I'll go over some COVID numbers. I will have to disagree with a little bit of the song of the, I don't know how fair it is to say there's nothing to fear, and I won't tell a lie, because that might be a little fear. We're on the better slope right now, for sure, but there's still fear out there, I'm sad to say. So I'll talk about COVID, a little health legislation, and then the massive health ballot measures that you'll get to probably see later this year. You know, take your health while riding home is the way I look at it. So COVID, we are at 2 years at this point. I was here 2 years ago making jokes about Corona bottles and this thing that was, you know, didn't think it would be big. We'd seen previous SARS before and swine flus, and that everybody worried. And what's happening now is what we thought was going to happen with Ebola. And, you know, systems worked and we didn't get those things. I don't know if any of you have seen or heard of the show Station 11. That was, I think it was on, was it Netflix? But hit big, maybe it was HBO, just about a month ago or so. It's written about a pandemic that sweeps through and kills 90%, 95% of the people immediately, and then it's the post-apocalypse of that. That was inspired by the avian flu, and that writer went a few years ago and wrote it. It was traumatic watching the first episode and seeing it is happening as we've lived through it for 2 years, and luckily it was more inspiring story after that. But these have been things we've been dealing with. A little update on where things are at right now. At the top, you have national numbers, just for context. So we've had almost 900,000, it's probably over 900,000 people die with COVID. And that's terms that have become more and more for debate and need to be figured out, I think, a little better. And I can talk about that or answer questions to that. And 4,600 as of, like that's about 2 weeks ago here in San Diego. So this is significant. I'm sure many of you have had this impact in your lives. I've had friends that have been impacted. I've been lucky. I don't think I've had anybody pass, knock on wood, that I know closely, but I've seen the impacts and I've seen it on other friends and family. Vaccinations. Vaccinations are a huge piece of debate in our society and how we're putting rules and regulations forward on that, either by executive order, judicial impacts of that, school boards and other stuff like that, legislatures, who has the right to do some of these rules and who doesn't. We've been watching this play out for a long time. That will continue to. But I think, you know, as much as there's controversy with vaccinations, you're seeing that most of America has adopted and picked up vaccinations. So this is everybody who's had at least one dose of the total population, over 75%, but looking at adult population, over 87%. The elderly population, thankfully, over 95%, because that's the people who had the biggest risk, biggest impact of it. Fully vaccinated, that means 2 doses. Again, that elderly population, over 88%, full adult population, almost 75%. Boosters have not been picked up as much, and I was a late adopter to a booster as well. So I got my first vaccination early. My charity, the Medical Society, has a charity, Champions for Health, and we were asked by the county to do vaccination events. They've gone and vaccinated 31,000 people over the last year, done over 600 clinics all across the county in the hard-to-reach areas, go to people who are homebound. And as they were training their nurses, they called in the staff as guinea pigs so they could learn how to get the shot. So I was a little lucky and got one early, and I got my second early, and then the boosters became available, and I was like, oh, I'll get to it when I have time and stuff like that. And I waited till late December when I ended up having, right around that same time, 2 close encounters. A friend of mine was staying with me because his wife had COVID, and then he got COVID at work, and he'd been playing a board game with me the night before, and luckily it didn't hit. I think Jameson is very helpful in my medicinal system for that. I treat that as medical advice, not a doctor. But I hadn't got, I waited on it, and I have it now, and I feel better. And if I get it, and we'll look at some numbers here in a second, it is showing again and again of keeping people out of the hospital, keeping serious illness away. And I think that's the biggest part of the debate. And I think the confusion, I didn't know, again, I'm a health advocate, but I'm not a physician. The difference levels in what you're looking for in protection, and much of what vaccines protect for, all vaccines, is diminishing the level of illness, the severity of illness, keeping you out of hospitalization or the damages that come from that. And so we've had this ongoing debate, and it's getting very contentious in our society, and it makes me sad that it's got that way, because there is so much help that's been shown and happening. Here's some charts. Who do we have here? Oh, these are case rates here in San Diego that lead to hospitalization, or these are case rates. You see they're not fully vaccinated, spike dramatically above. The green, the middle line, is fully vaccinated, so 2 doses, and then people who've had boosters, even smaller than that. So these are real numbers of people who've tested positive in the last few months here in San Diego, that average. You can see that the more vaccinations people had, the less they were testing positive. More importantly, hospitalizations. Not fully vaccinated, and again, this is just the last 3 months, 1,100 of the people who've been hospitalized locally in San Diego is because they're not vaccinated. Get over to the fully boosted, only 134. It's not perfect, but it dramatically cuts down on the impacts. And then here again, hospitalization rate by vaccine status. So these are the people ending up in the hospital. You can see graphically, they make a difference. And I hit the hospitalization part a little more about Omicron for a second. Omicron, I think we've all seen, it's had less significant sickness, challenges to people. Even if you get sick with it, when my neighbor did get it, it was less than 24 hours of, feeling pretty miserable, couldn't sleep that night, but he recovered in less than 24 hours. He'd been vaccinated. I don't know if his booster was current then or not. We're not sure what the reason for that is. If it's just a weaker strain, or if, frankly, so many people had died already who were more susceptible that the ones were getting less. If that's the case, there can be some positive news. During Delta, a lot of my physicians were thinking Delta would be the last one, and that the spread would get enough past the people who'd been vaccinated. So you have the people who vaccinated who are mostly going to be okay. The people who weren't getting Delta, that didn't. They were hoping that would be the last surge. Then we got Omicron, and we've had another surge. And after that, I'm afraid we might have another. But there is a school of thought out there. And again, this is the art and science of medicine part. The art where they don't know for sure. We don't know for sure. But at some point, the spread is happening along with the vaccinations. That's pushing down the number of people who can get sick from this or have impacts of it. The real challenge, though, of all of this, and there's a lot of obviously individual liberty rights, whether or not I want to do this or not, if it's affecting me, is our hospitals. And even with Omicron having much less severity, we have more people in the hospitals right now in San Diego and nationwide than we had in any other of the COVID surges, COVID bumps we've had. Excuse me for a second. And that's really the impact that we're having. And that's causing huge troubles throughout our healthcare system. The emergency room waits, this is the beginning of the year, the top number on, so it's just our emergency rooms locally, crusted at 4,000 the first Monday of the year, and still higher than it was all of last year. So going through original and Delta, and even year one, when you remember we were having huge problems there. The problems we were having in the first waves was ICU access, people getting severely ill and staying a long time. Over time, we've learned treatments, how to better treat them. We've gotten medications to treat people. So the time in hospital has been going down and down as we've gone through this crisis. We have been learning and doing it better, but nonetheless, just the sheer number of people who've got Omicron, and even if it's a smaller percentage, that's still more numbers going in and overwhelming our system. And so I've been on calls for the last 2 months that are desperate in our town. Hospitals looking to try to close, not take new people to the county, then saying you can't do that because all the hospitals were overwhelmed, and so you couldn't keep diverting ambulances. Stories of ambulances sitting in parking lots for 7 hours or so. And then you have the side effect that's happened. People haven't been getting care. So right now we are getting a lot more people in the hospital sick from those chronic conditions that they've had and hadn't been treated. Cancers haven't been treated. Diabetes have gotten out of control. All of those things. So first off, go get your checkups if you haven't had it already. Take care of your treatments that you have. And I say that badly because I have not seen my doctor in over 2 years, and I know I need a checkup and get all those fluids measured. But it's becoming a real problem in our system. And then those people are getting in COVID, and that could either make it a little worse or it is secondary while they're there. But nonetheless, we're having this real pressure on the system. It's starting to relieve now. The numbers are coming down as they are across the country. But again, I can't promise that we don't have, where would we go? Omicron, Rise, Psi, Omega or so as the next. They're skipping a few of them. And then backlash. You're seeing this more and more stressed, and it's creating a lot of stress and frankly, resignations in healthcare. We had burnout and satisfaction issues in healthcare for years before this, and this has just amplified it. The Medical Society does a clinical town hall every few weeks during surges, and then once a month. The highlight topic, knowing that we were coming down for this, is going to bring a psychiatrist on and talk about burnout issues and what we can do to proactively do. When you're in the pressure, the stress, there's not a lot. The doctors aren't going to pay much attention to things they can do. They don't have time to do that. But now that we're coming down from it, realizing that and trying to engage it so it doesn't overwhelm people, so we don't end up in the worst case scenarios of suicides and other terrible things that can happen. But it's going to be a real problem. We've had a shortage of healthcare workers. That's been a policy issue. I think I've talked about it here in past years and things the state has done to try to encourage all levels of health workers to get in the system, to expand math and science education, to get more people doing it. And this has just exasperated it. There's no end. Vaccinations, just really quick, if any questions. Moderna just got full FDA approval on January 31st. So now both Pfizer and Moderna are fully approved. They've got all the big data in, not the emergency approval that people had been concerned about. Pfizer is currently approved 5 to 17 years old. And next week it goes in for 6 months to 4 years. That will likely get approved and they'll start giving doses by the end of the month is the expectation right now. As a matter of fact, that reminds me that I need to call my charity and have them start preparing to start doing young vaccinations because we don't really have systems for that, and there's not enough physicians who have been licensed or registered to do those things. So that's coming probably this month. Any questions on COVID before we move on? I can take more at the end too, but great. Yes, sir. Yeah, thank you very much for bringing that up. Johnny, for those at home, Johnny asked, do I think the public is looking more at COVID as endemic than this pandemic situation? I think that is absolutely the case. Not just the public, many doctors I talk to. I think everybody in life is tired of this and looking at, we need to live lives. We can't be hurting our businesses, our society, our children, and the challenges that are happening in our schools. We need to have a comprehensive solution. And it's actually sad that we're at 2 years and we haven't made that transition. We hadn't figured that out. The governor, you've probably seen the news, as of next week, the 15th, the indoor mask mandate is being removed if you're vaccinated. And at least for adults, they haven't given out the details yet of how that's going to affect schools. But he's also said he's going to release a broader endemic plan or strategy. And I think that's where a lot of people need to go. I only see frustration out there. And again, even among many of my members. Okay, move on to some legislation. So the big news in healthcare legislation is something called CalCare. It was also known as Assembly Bill 1400. It's a single payer healthcare system, and it's supposed to be the framework, the structure of a single payer healthcare system. This has been a big push. This legislation specifically was introduced last year. This is probably the third single payer system in the just over 6 years since I've been here in San Diego. But this one has gotten the most traction. It had a big legislative deadline on January 31st. A huge push from the author and supporters of it, threatening members of the legislature they wouldn't get their endorsement from their party if they didn't vote for this. It ended up not coming up for a vote. He realized he didn't have the votes. I think there was probably pushback by colleagues who didn't want to be put on the spot, and the bill didn't come up. In addition, they introduced a companion bill with this, which would be the funding mechanism that would institute a new $163 billion in taxes to help fund this system, which then in addition would have to take the $250 billion in healthcare funding that we get from the federal government for Medicare and Medicaid. All of those monies would be put together to create this system. So it didn't come up for vote this year. On the record, the governor has said he supports a single payer system. He didn't say about this one. The Speaker of the Assembly said he supported this bill. There's a lot of push. I think this will come up eventually. For just practicality, the politics within the Democratic Party has been pushing this in leadership more and more people who are in elected office are supporters of a single payer system, and the Progressive Caucus has been the big one pushing this. There are some that doesn't mean to paint all Democrats with the same brush. There are many against it or worried about it for their electoral reasons, but the pressure is growing, and I think you will see something like this to the point, though, that it will go to a vote of the people. As they've written it, and as they likely will, it requires those taxes that would have to get voted on by the public. And I think a lot of legislators will finally look and say, hey, I might not support this policy directly or want to do this, but let the people decide, let the people vote. And so, my guess would be 3-4 years or so, you'll see something like that on the ballot. Could be a little longer, but that's just it. It's been taking up more and more oxygen, getting more and more support, and that's a lot of the times how the legislative process works. A bill gets introduced and it gets shot down, and then it gets introduced again and it gets a little more support, and then eventually you actually get that ball pushed up the hill and get something done. So that's been the biggest and dominating discussion in healthcare legislation, and it's a big one at the federal level as well, but practically here it had a lot more push. The pushback from a lot in healthcare, so in a single payer system, your health insurance would be illegal. We would not have Blue Shield or Kaiser. Those businesses would go out. There's a possibility you could have over coverage, like an Aflac kind of thing, and over the top for things that are not covered. I don't know that it was clear in this one if that's even allowed or not, or we all have the same benefits. The worry is they tell you that it will be like a Medicaid system, which is considered pretty good access wise, keeping doctors having access to your health care. But the worry is that it'll be much more like Medi-Cal, and people who have Medi-Cal, it's better than not having anything. And many, over a third of the people in California are on Medi-Cal now. The problem is access to healthcare is very limited in Medi-Cal. People on Medi-Cal will tell you finding a specialist can be incredibly hard. There, in rural areas, there won't be one for hundreds of miles. Things like telehealth help a little and stuff like that, but you still need the physical interaction with the physician and the ability to get treatment. And it's really hard. Our charity does work for people who don't have coverage or don't have access. We get volunteer doctors to do specialty care because there is such a gap of that. And so that's the concern with the system like this. And then just how do you transition? How do you go from one to the other? And that's always dangerous on a $400 to $500 billion system that we have. The counter solution is try to get to universal access. Universal access doesn't mean just the government's paying, it just means everybody's covered. And frankly, with budget surpluses the last few years, we're down to about 6% of people who are not covered. In the newest budget, the governor has proposed to take care of most of the rest of that donut hole, where you only have a few stragglers, probably a few percent of people who are not covered or at least not eligible for Medi-Cal, and to be able to get coverage. And so that's the counter way that I think kind of the establishment wants. And again, there's a lot of problems in healthcare. Please don't look at me as wanting to defend our insurance system. My doctors fight insurance companies more often than not. The hospitals fight the insurance companies. We all have conflicts with each other, and we're all trying to work together at the same time. But there's a lot of problems with it. I needed to get a CPAP machine. I have pretty good access to doctors. I know the bosses of all the groups, and it still took me 6 different appointments when I had to go through that. It was, very much a system to try to push you to not go do something like that, which is sad. But the fixes that we're seeing, at least for the time being, are coming through just to expand that access, put money in the budget from that. When we don't have a budget surplus, I worry how that's going to go. It's easy, it's relatively easy when you have $20 to $40 billion surplus coming to spend $1 billion here and there to give coverage to some people. But all of these new coverages are not funded by the federal government the way the rest of Medi-Cal is. Medi-Cal traditionally is 50-50 funded by the government, by the feds and California. For every dollar we spend, they would give us $1. Other states get more money than that. Some states get 2 to 1 if they're poverty states, but we get 1 to 1. When the Affordable Care Act, Obamacare, came across, the expansion of that was funded originally 100% by the feds. That's how they got you on. But long term, it was promised to be 90%. And so the expanded universe, they're giving 90%. So it was relatively easy to take that money. You're getting many more dollars for what you spent. These new expansions are mostly for undocumented. This newest expansion in the budget is for anybody from 18 to 50 who's not documented, to make them eligible for Medi-Cal. That's 100% paid for by California General Fund. The last budget the year before, we did, I think, 50 through seniors. And before that, we had done children, so 18 and under. Oops, there we go. Yes. That is in the budget, and I don't remember it. And since I can't lie, I promise. No, I think it's a few $1 billion in this new expansion, but I just don't remember exactly. Apologies. Sorry. For those at home, the question was, how much was the cost of the expansion? And I think it's a few $1 billion. I'm not certain. Ballot measures. What's this new slide? This new slide is not mine. Uh-oh. We're off. No. We're missing the last few. Okay. Where's my time? I'm supposed to be done, but I can wing ballot measures. Huh? I've got 10? Okay. Let me wing through some ballot measures on the fly. I think there's like 2 or 3 confirmed healthcare ballot measures that you will see on the ballot, or very likely to see on the ballot. And then there's 3 or 4 more that are in the between or pending. The first, flavored tobacco ban. The legislature passed a ban on flavored tobacco a few years ago. It would be a statewide ban. You couldn't have menthol cigarettes or flavored vape pens, or anything that was in tobacco could not be like actively flavored. The idea being that targeted to kids. That's how they get young people to pick up the habit, and goes on for life. The tobacco companies referendum the legislation. So any legislation that's passed in California, you have a short window where you can get enough signatures and put it to the ballot. And so that's going to be coming. So that's the first one that's guaranteed you will see on the ballot. You'll be voting on whether or not you want that bill to pass and become law or not. The second one that you're likely to get, I don't think it's confirmed yet, but you will almost for sure get, is a dialysis ballot measure that puts new regulations in the dialysis industry. You might be familiar with this because 2 years ago, you voted on a dialysis ballot measure. Or you might be familiar because 2 years before that, you voted on a dialysis ballot measure. They have failed the last 2 elections. Big Dialysis has spent like $100 million each time. I think 110 the first time and 102 last time to defeat these measures. But I'll tell you why this keeps happening. The Healthcare Workers Union, these are private companies that primarily do lots of the dialysis. Oh man, who are the Fresenius? There's another one that's more recognizable. But anyway, there's big companies that have most of the dialysis centers everywhere. They don't own everything. Sometimes your insurance will have you somewhere else, but a few companies, and they're privately held companies, and so they're not unionized workers. And so the healthcare unions have been pushing to unionize them, and what they're trying to do is either get the legislature to require it or to have them compromise in doing it. And they keep pushing these ballot measures as a way to jam them. And it takes them only a few $1 million to get something on the ballot, to collect enough signatures. You can do that for $4 million. And then that puts a huge target on these dialysis companies. So that's why you've been seeing it. Voters have kept voting it down, and I presume that'll be the same this year, but get ready to vote on the same thing yet again. The next ballot measure is one close to my heart, which is, it's called, what is it? See, this is where I needed the slide. It's the flip. Anyway, we don't have ballot numbers yet. Those will be coming for a few months. But it's injured patient protection. And what it would do is change the medical malpractice laws in California. You voted on a related ballot measure to this in 2014. So at least you've had 8 years off since then, but that went down 2-1. And what this would do would massively change the malpractice insurance laws that we have in the state. And they'll tell you that it's not fair for some victims. There's cap on pain and suffering. What they won't point out to you is there's unlimited amounts for economic damages, for your healthcare costs, for lost income, and that what they're really doing is taking away all the caps on lawyers' contingency fees in doing these cases. So as part of the malpractice protections that were put into law many years ago when we had a crisis, part of the cap was how much money the lawyers could make. So they could make a third of the first batch, $50,000, but then it scales down as the award gets higher so that the patient gets the money. This would take it away, and you get to your traditional sense where lawyers can take a third or 40% of the payout. And so that's really what they're doing. One lawyer from Montana spent $4 million to get this on the ballot, but he's promised to spend $40 million to help get it passed. So you'll be seeing a lot of that again this year. It should have come up. They got the signatures in time for it to be on the last ballot. But in that first year of the crisis, where everybody was going out at 8 o'clock every day and honoring healthcare workers, they realized that might not be a good time for them to be attacking healthcare workers. And so they pulled back. They held the signature, so we'll be getting it later this year. But you're going to see the medical side, so the hospitals, the physicians, the dentists. We raised $60 million to defeat this last time. There's already 45 million in the bank to defeat it. He said he'll spend 40. They only spent 10 last time. So you're going to see a lot about that. So those are the ones that I'm pretty sure you're going to see. The next one, there's a good chance, and it's a pandemic response ballot measure. It would increase taxes on income over $5 million a year to pay for, and half of it would create a center to prepare and study and do things for the next pandemic. And then a quarter would go to funding modernization and improvements, health improvements in schools, and a quarter would go to fund public health. And my understanding of that is that it looks like it's well funded enough to get on the ballot, to collect enough signatures. But even then, this was just text on the slide. It was the only one of the few that there's no images. They don't have a campaign out yet. They're really just starting, but I think there's some good funding backers for that. And then there's another ballot measure that's also a pandemic response, but the other way, that would limit emergency powers of government to 30 days in a future pandemic, public health thing. So you wouldn't have what we've had for the last 2 years, where the governor's declared emergency powers and keeps doing executive orders for school districts and the rest. This would be a response to ban that. I haven't seen any funding for that, and without funding, it won't get on the ballot, but it might be there. There's enough upset people with big paychecks that you could see something like that. With that, I think that's the end of my prepared remarks. Yes, Dr. Moore. So the question is restrictions on vaping in the legislature. I think the biggest was this flavored tobacco that passed. Now it's pending, it's in abeyance until it goes to the ballot measure. I haven't seen anything more specific. There's a ban on single filtered cigarettes that's being considered. That would effectively, it would ban single-use filters, so it would effectively ban your standard pack of cigarettes. You'd have to either have rolled cigarettes or, I don't know, olden days, long ones. I'm sure tobacco companies will find a solution, but that would be a big battle. They would probably put that to ballot measure as well. Yes. Travel nursing. No, so the question is about travel nursing and your neighbor leaving her job here as a nurse to go spend a year in Texas as a travel nurse. And I've been watching that through this process. It doesn't make sense in a lot of ways. Like, we have depended incredibly on travel nurses to keep things around. You might remember when PECO did the first big vaccination center at the beginning of last year. And I went down and volunteered on one of them. And my area nurse leader, the person actually giving the shots, was a travel nurse. And she was in the middle, like, she'd been here a little longer because the new lockdown had happened and no travel. So she'd done two, but she had done a few stints before and was in Colorado earlier in the crisis and do it. And like, she was young and a vagabond and she wanted to do this, made a lot of money doing it. And she liked going to different areas and being in different places. And, you know, I know when we've had surges around Christmas, around the holidays, you can't get any travel nurses. They all cut down because they spend with families, but then it spikes up. And in January, both the surge last year in January and the surge this year, it's been a huge help, but it ends up they're paying a lot more. And so for that individual's perspective, you know, whatever her salary is now, she's probably making 20, 50% more to do it. But then the local hospital is going to have to pay 50% more to get somebody in to cover that work in time. And I mean, it's bad economics. They're using their power to do it, right? Like, if you had monopolies, you could stop it, but that's why we don't have monopolies, is kind of free market of that. But it's been a huge problem. And the hospital systems try to talk to each other. There's some that organize with the state a little. The state will help get contracts for places that are in hard need and get some people into those places. But it's added to the pressures. Anything else? Well, thank you very much. I hope I did all right. We'll see if I get a 5th time. Now, is it like Saturday Night Live? If I come a 5th time, do I get a jacket, or how does that work?
Well, you're not leaving without something.
Oh,
I have for you your cherished copy of the words to
It
your
is.
song. So
Thank you very much. It always
right.
is.
Thanks.
I appreciate it.
Thank you. So over the weeks to come, we will occasionally have a few minutes just to highlight some of the big picture that we deal with in Rotary. So I think what we'll do is we'll take one event. I'm going to ask Bob Dweebler to come up. You know, it's important for us to maintain some sense of who we are in the midst of this international Rotary organization, because we see each other each week, we see what is happening here, but the flavor of Rotary is worldwide. And so I've invited Bob to share with us some aspect of Rotary that we don't see frontline, but is doing such a powerful amount of good, and we are participating. So, Bob.
Good afternoon, fellow Rotarians, and President Vaughn, thank you. Vaughn asked me to speak about the advancement of international understanding, goodwill, and peace through the ideal of service. We have to revel in our accomplishments because this club contributed over $20,000 to international projects highlighted up here on the screen. In Mexico, we had a new tractor for an agricultural high school in La Paz. In Uganda, we had Toilets for Life. In Kenya, we had microcredit with 300 plus loans. In Costa Rica, we had a grant for teaching culinary schools. In Nicaragua, we had aquaponics. And then we had Project Mercy in Baja, Mexico to build houses, plus ventilators in Brazil. So altogether, we contributed $20,000 with $10,000 of direct grants from Rotary for a total of $30,000. So congratulations to all of you for making that happen.
Thank you. And I do think we have a vested interest to be proud of what's going on in the world and what we do in our contributions. With COOR coming up, you may want to consider who among your friends, business associates, we should talk with to invite them, number one, to consider membership in this organization, and number two, perhaps as a natural consequence, that they might feel a reason to invest in Rotary's worldwide effort to improve mankind. So with that, I would just give you our final reminder: make a friend, wear a pin, bring a guest, have a great week.